Welcome back, everyone. Today, we're tackling an explainer that takes some incredibly complex ideas and breaks them right down into clear visual concepts. Okay, let's dive into this. We're exploring a seriously fascinating piece of 19th century medical philosophy, Samuel Hahnemann's theory of chronic disease, specifically the chronic miasms. We'll look at the historical medical mystery that actually sparked this whole idea, how the theory was structured, and how modern practitioners attempt to integrate it today.
Here's our roadmap for today. First, the problem of relapse. Second, the classical miasm triad. Third, unmasking mixed miasms. Fourth, modern interpretations and epigenetics. And finally, clinical safety and boundaries.
So to start, I want you to place yourself in Hahnemann's shoes for just a second. Imagine you're a physician in the early 1800s. You've got patients coming to you with chronic issues. You give them a treatment, their symptoms temporarily improve, and hey, everyone is happy, right? But then, inevitably, those symptoms return, they change form, or they even get worse. You've got to ask yourself, why? Why do some chronic diseases always seem to come back despite what looks like a perfectly suitable prescription?
Which brings us to Section 1, the problem of relapse, or Hahnemann's clinical mystery.
That frustrating cycle, that is exactly what Hahnemann needed to solve. He realized that treating a short, acute episode was just completely different from treating a long-standing, recurring illness. And this brilliantly illustrates his timeline. In his early practice, he was basically just identifying this frustrating pattern of temporary improvement followed by relapse. Then, pre-1828, in his foundational text, The Organon, he really starts refining the difference between acute and chronic diseases. And finally, from 1828 onward, he publishes The Chronic Diseases, which formally introduces his miasm theory to explain all this persistent recurrence.
The core realization he arrived at was basically this: a deeper, persistent cause remained. He hypothesized that these returning symptoms weren't just new, random acute illnesses, but were actually the expression of an underlying inherited or acquired chronic tendency. He called these tendencies miasmas. Now, it's absolutely crucial to view this neutrally. This was his historical explanation for what he was observing in the 1800s, not a universal biological fact as we understand biology today.
Moving on to Section 2, the classical miasm triad, Psora, Sycosis, and Syphilis.
Now, what's really interesting about this slide is how this classical framework bridges 19th century terminology with concepts we actually understand today. Hahnemann grouped these into three main categories. First, Psora, which was historically linked to a wide functional disturbance, correlates to modern functional issues, sensitivities, or deficiencies. Think things like allergies or neuroses. Second, Sycosis, stemming from a figwort tradition, correlates today with excess and proliferation, like benign tumors, cysts, or metabolic excess. And third, Syphilis, which comes from the venereal disease tradition, maps to destructive and degenerative pathologies, like autoimmune destruction or severe ulcerations.
To really cement these categories in your mind, just think about the extreme ends of the spectrum. Psora is all about functional disturbance. The body is highly sensitive, it's reacting, maybe it's deficient, but the actual physical structures, they are mostly intact. Syphilis, on the other hand, represents severe structural destruction. We're talking ulcerative, degenerative processes where tissue is actively breaking down. Grasping this contrast really helps clearly categorize these historical interpretive concepts.
Let's jump into Section 3, unmasking mixed miasms, also known as complex compound states.
Because in clinical reality, patients almost never present with just a single pure miasm. That'd be too easy, right? They present with complex, multi-layered states that require some really careful analysis to untangle. The most famous example of this is the tubercular miasm. This is essentially a theoretical combination of the functional sensitivity of Psora mixed with the destructive tendency of syphilis. Historically, practitioners would categorize patients under this mixed miasm if they showed overlapping symptoms, things like rapid emaciation, chronic respiratory weakness, and a restless, constant craving for travel or change.
So how in the world did historical practitioners deal with these complex layers? Well, they approached it a lot like an archaeological dig, using what they called sequential prescribing. Step 1 is to just observe the surface layer. What is the dominant active miasm right now? Step 2, you prescribe a remedy strictly for that present active totality of symptoms. You literally do not try to treat everything at once. And finally, step 3, as that surface layer clears away, you address the deeper dormant layers, but only as they emerge over time.
So the crucial point is captured perfectly in this sort of golden rule. Prescribe for the present active surface layer, not a historical assumption. Think about it. If a patient has a deep family history of destructive pathology, but today, right now, they present with an active surface layer of simple functional allergies, the practitioner has to treat the allergies first. You always treat the active reality sitting right in front of you, rather than just guessing at a dormant background layer.
Okay, moving right along to Section 4, Modern Interpretations and Epigenetics, Bridging 2 Centuries. Let's move to and see how this builds into modern practice. How exactly do practitioners interpret these 19th century ideas today? Well, historically, miasms were viewed as these inherited chronic disease predispositions that could lay dormant or be triggered. Today, we have modern epigenetics, which studies how environmental factors, stress, or toxins can actually alter gene expression, turning certain genetic predispositions on or off without changing the underlying DNA sequence itself. It's really fascinating stuff, and many modern homeopathic practitioners use epigenetics as a scientific framework to explain exactly what Hahnemann was observing clinically over 200 years ago.
Because of this evolution in thought, there are basically 4 distinct modern interpretive styles used today. First, the classical style, which focuses strictly on what Hahnemann meant regarding chronic causation. Second, the constitutional style, focusing on inherited susceptibility. Third, the pathological style, which hones in on recurring physical tissue tendencies. And fourth, the thematic style, focusing on recurring psychological or adaptive patterns. But remember, a truly useful interpretive concept should just clarify history-taking for the practitioner. It definitely shouldn't be used just to slap a historical label on something that modern biology already perfectly explains.
And that brings us to our final section, Section 5. Clinical safety and boundaries, and why practicing responsibly is everything.
When applying these historical models to modern patients, practicing responsibly is just absolutely paramount. First off, practitioners must actively avoid confirmation bias. You can't just cherry-pick symptoms that fit your preferred theory and ignore the rest of the picture. Second, never reduce a complex living patient to a fixed historical stereotype. Third, don't force ambiguous symptoms into a neat theoretical box just to make the theory work. And finally, any use of these models must complement, not displace, necessary conventional medical care.
It is absolutely critical to establish a firm objective boundary here. Miasmatic theory does not diagnose cancer, infection, or genetic disease. Full stop. These are historical, interpretive models used to understand symptom patterns. Progressive pathology always requires conventional medical investigation and urgent referral. A theoretical label is literally never more important than a patient's actual physical safety.
As we wrap up this explainer, I want to leave you with a provocative question to chew on. How might historical medical philosophies continue to evolve and adapt alongside modern scientific discovery and clinical safety? We've seen how Hahnemann's attempt to solve the mystery of relapse led to this incredibly complex framework, one that practitioners are now trying to view through the modern lens of epigenetics. It's a truly fascinating look at the history of medical philosophy, but as we've learned, it's one that must always be anchored in present-day safety. Thanks so much for joining me on this deep dive. Keep questioning, keep learning, and I'll catch you in the next explainer.